Welcome to Privacy Abbreviated, brought to you by BBB National Programs. As our regular listeners know, our goal here is to help business leaders prepare and operationalize for what's next in the privacy space. I'm Dona Fraser, Senior Vice President of Privacy Initiatives at BBB National Programs. So here at BBB National Programs, one of the several privacy programs in my wheelhouse is our Digital Health Privacy Program, DHPP. We have tons of acronyms, and you'll hear more acronyms today. DHPP provides guidance and best practices around the collection and use of non-HIPAA health-related data. And outside the scope of that program, we find ourselves receiving a lot of questions from product developers, app and website operators, and the like about the overall challenges regarding health-related data. And some companies are definitely in the space and fully aware of the challenges. Others may be providing services to these first parties and find themselves trying to really get a grip on all of these challenges and questions on both a federal and state level. Today, we want to hone in on a specific aspect of the health industry, telehealth. In a post-pandemic world, I have to imagine that the telehealth industry has exploded in a way that no one could have predicted. So we thought this would be a great opportunity to have a conversation with today's guest, Kyle Zebley, who is Senior Vice President of Public Policy at the American Telehealth Association, or ATA. Kyle, thank you so much for joining us. It's a pleasure to have you.
Donna, great to be here. Thanks so much for having me, and looking forward to our talk.
Thank you so much. So let's dive right in. Talk to me about what is the American Telemedicine Association, ATA. What is it?
Well, we're a nonprofit organization based here in Washington, D.C. We've been around since 1993. We consist of more than 400 organizations in the healthcare space, and it really ranges the whole gamut of healthcare, from hospital systems to commercial payers, virtual-only providers to academic medical centers. We've got folks that are innovative in the deployment of telehealth, such as the Veterans Administration as part of our Big Tent membership, pharmaceutical and medical device manufacturers, and just about everything in between. And what we're trying to do is really simple. It's trying to make sure that every American can benefit from care where and when they need it. And we've had tremendous gains in that level of access to care these last 4 years in particular, since the onset of the pandemic. Even though we've been around since 1993, this will be our 31st year in operation.
Yeah, I can't imagine when I think back to the pandemic, which in some ways seems like a decade ago. In other ways, it seems like it was just last year. But I can't, when I think back to it, when we were, in the height of the pandemic, I can't imagine how we would have survived, me personally and my friends personally, without the ability to have telehealth.
That's absolutely right. And it was really, kind of proof in the pudding. For so many Americans and for the healthcare system broadly, there was reticence to really fully come to terms with what was possible back in 2020, just about 4 years ago. The technology was there, the clinical appropriateness was there, the academic research underpinning it was there, and yet because of the kind of small c conservative mindset that patients and providers have, a very tiny sliver of total medical encounters were done via telehealth. And that changed, and not only did it change almost virtually overnight. Friday, the 13th of March, 2020 was when the world really shut down as we know it across the country. And so in very short order, come that weekend and the weeks following, so much of what had been done in person became virtual in nature, and not just synchronous audiovisual telehealth, but other areas and modalities of healthcare. That was done because federal and state policymakers put in place a lot of wonderful temporary policies. And that was really important, but it was also done because all of a sudden there was no other real option except for emergency situations. And it turned out when people tried it, they liked it and they wanted to keep having access to it. And the same goes true for the provider side of the equation. Providers that may have been dubious about its efficacy prior to the pandemic were resoundingly near unanimous in their perspective that, gosh, a lot of my work can be done this way. I can deliver really effective care in this manner.
Do you think it was just merely getting past the use of the technology, or that in combination with, okay, I've just always seen my patients in person. I think technology oftentimes is what causes people to be reticent about doing something because they just don't know how it's going to work, right? And when you don't know how something is going to work or how it's going to turn out, people just have these fears, and then those fears end up becoming, somewhat irrational to the point where you just don't engage. So, do you think it was just merely the technology?
Well, it was two things, both really important. I handle public policy. I lead our public policy efforts as senior vice president of public policy, and also deal with our advocacy efforts through ATA Action, which is our affiliated trade organization. So, of course, I would have to say that part of the issue was state and federal government policies that weren't flexible, hadn't kept up with the technology, unduly restricted the ability of providers to offer it and for payers to cover and get reimbursed. Particularly, for instance, Medicare was really reticent to cover it because of restrictions put in place by Congress. However, to your great point, that's only one part of the equation, and really the other part of the equation is maybe more important. And that was the comfort level with patients and providers just wasn't there. I think it has a lot to do with technology. I think it has a lot to do with the huge lag time in making big change to our healthcare system. And so I think that while, yes, the policies were an obstacle, there's no question about it, the other end of the equation, as important, if not more so, was one that was more cultural in nature, and why it's why the healthcare system in general it's so hard to pivot to bring on new technology and deploy the latest and the greatest of that technology in the
Right.
best interest of the patient.
Right. I mean, unfortunately, that's not unique to the medical or telehealth industry, right? I mean, we're facing that on so many different fronts.
It's human nature. It's like
Exactly.
my
That's right.
wife that convinced me to go ahead and buy a home. I didn't want to at the time. I was comfortable with my life the way it was, and gosh, that's leaping into the great unknown. Now I
Right.
can't imagine not having done that,
Not having
or
one there.
things
Yeah.
like that. It's
Yeah.
just human nature.
So you talked briefly in your introduction about some of the different kinds of ATA members. Let's dig in a little bit about that. Like, are we looking at large platforms? Are we looking at the smaller telehealth apps? Is it everybody in between?
Everything in between. So, for instance, in our membership, we have some of the largest companies and corporations in the world by revenue that do many things, to include an ever growing series of interest in telehealth and virtual care options. Think, the Amazons and the Walmarts and the CVSs of the world. We have virtual only providers that are really have been really on the cutting edge of innovation of what can be done in this mode of care, like Teladoc Health or Amwell. We have direct to consumer areas of care that are done in a way that really meets patients where they need it most, like Hims and Hers, for instance. That's been really on the cutting edge of that type of model of care delivery. We have many of the largest pharmaceutical manufacturers in the world that have a vested interest in, again, making sure that the healthcare system is taking advantage of full efficiencies. So too, in terms of some of our medical device manufacturers, think, for instance, in that regard, Philips, who are coming up with really cutting edge, innovative remote monitoring technology to connect the patient back to their care team, and coming up with bespoke care models for that patient through the use of remote monitoring technology. We have some of the largest payers in the country that not only are taking care of the payment side of the models, payment side of the equation of care delivery, but are also now innovating in the direct care delivery. So Cigna, United Health Group, Humana would be an example of those types of members. We've got academic medical centers. We've got one of the largest healthcare providers and health systems in the country that's on offer to every veteran, the Veterans Administration, that really deploys the full range of healthcare services. Every type of telehealth you can really imagine is being done through the VA. And that's just a small snapshot. Again, over 400 organizations. When you think of the U.S. healthcare system, we have basically every type of player possible within that diverse ecosystem, the most complicated healthcare system in the world.
I do want to talk a little bit more about that. Specifically, what are the data privacy challenges that your members are facing, and how do you think the new privacy state laws are impacting telehealth providers? And I know that you have, and you could talk a little bit more about this, a data working group and your data privacy policy principles.
That's right. Well, it's an extraordinarily important topic for our members, and one that frankly has started to get a lot more interest from federal and state policymakers, at least from my vantage point, working as for the ATA, which is the voice of the telehealth community. It's become a lot more prominent over the course of the last 15 or so months, or really since the beginning of 2023, I would say. When we talk about telehealth, it's really important to keep in mind that from our perspective, telehealth is healthcare. And so issues that the healthcare system broadly, that they have to grapple with, it's of course true for us. And we have had a model in place these last 30 years at the federal level in the form of HIPAA, the Health Insurance Portability and Accountability Act, that has given a lot of comfort to patients. And it has set clear guidance for providers as to the expectations that they have to adhere to in following the letter and the spirit of the law in terms of protecting the private health data, some of the most sensitive data out there, protecting the data of individual patients. And I think that one of the big new areas of interest we have is in state policymakers. If the federal government, through laws like HIPAA, set a floor for every state in the union, and what I mean by that is no state can have state privacy laws on healthcare or anything else that's more lenient than the federal law. They can be more stringent. And indeed, we saw right before the pandemic a new policy privacy framework, for instance, in California, take effect. But then at the end of 2022, beginning in 2023, we saw more and more states across the country begin to introduce pieces of legislation that sought to either comprehensively create new kind of online privacy frameworks or were specific to health data privacy. And so at the beginning of last year, the ATA, with our Big Tent membership, convened a series of meetings throughout the course of last year of what we call our data work group. And our data work group broke into two committees, one to deal specifically with health data privacy, and another work group to deal specifically with artificial intelligence. And out of that came two sets of principles, including our ATA's health data privacy principles, that really just chart at a high level the course of our recommendations to federal and state policymakers. And obviously happy to speak to those if you like, but that was kind of how we got there.
Right. Do you think that regulators and the enforcement agencies are being realistic in the accountability that they're trying to hold people to in the health data privacy space? Like, what are they looking for when it comes to compliance?
Well, luckily for us, broadly speaking, the biggest area of compliance that we have in place is HIPAA. And HIPAA, having been passed in 1996, and been updated a few times over the ensuing decades, is really something that is near universally respected. the rules of the road are clear. It's been well established. Its enforcement proceedings are well known, and compliance with it is very clear in terms of adherence. There have been a few other states, and again, like I had mentioned, there was California. And one of the big policy principles that we've put forward in our issues is our hope that we get as much consistency as possible. And what we mean by that is state laws, if they're going to update health data privacy in particular, at least have a carve out for HIPAA compliant entities who are already doing their due diligence under the federal law. And we've seen a lot of states agree to that approach. And we would also ask states, if you're going to do something more stringent than HIPAA, which we don't necessarily recommend, but if you're going to do it, at the very least, try to adhere to a few other states that may have gone down this road, so that healthcare organizations, telehealth organizations, can have it easier to deliver care to patients in your state. Regulatory compliance is an expensive area where obviously our healthcare entities, our telehealth organizations are going to do their best to adhere to the letter of the law. But really, you're gonna cut out the medium and smaller organizations that aren't going to want to go down the difficult road of coming into compliance with your state's laws. And then you're going to inadvertently box out these medium and small organizations and leave that space open almost entirely to some of these largest corporations, including some of my own members who have the resources and the wherewithal to comply, even if states go a myriad of different
ways. And the impact that has on the patients. Right, at the end of the day, this is all that's supposed to be, right, serving the people in the state and the patients. Then you've only harmed them.
That's exactly right.
Yeah, and I can't imagine. I mean, we're seeing this in other areas in privacy where companies have to tackle this very challenging state privacy law landscape. To have to deal with that in the health industry would just be insurmountable on so many levels, especially when you think about data portability, right? If I'm moving from one state to another, as a patient, I don't want to have to deal with that. I should be able to keep my provider and not worry about any significant major changes that at least reduce or limit my rights.
Absolutely right. Everybody wants to make sure that consumers know their rights, and just about everyone in terms of my membership in developing these privacy principles make clear that there should be, consumer consent. There should be the ability to opt out of for instance, sale of data. Everybody wants to empower the patients, but we want to come up with a system that's workable enough to allow for something that's really, really important that you were just getting at in terms of telehealth. Telehealth, its great potential is breaking down geographic barriers. Its great potential is offering more clinically appropriate options to more Americans. Its great potential is helping mitigate our massive health workforce shortage and right-sizing the need of the patient population, which is great, with the limited supply that we have. And we're not going to allow for the full potential of telehealth, the dream of telehealth, the way that telehealth can help solve for some of the most intractable challenges in our healthcare system for 1/5 or 1/6 of our economy, depending on how you slice or dice it. You're not going to be able to do that if you're unduly burdensome and making things unduly complicated in the delivery of care across state lines. So that's why we seek as much consistency as possible, and that's why we seek, if practicable, a fallback to HIPAA and a reliance on more of a federal standard rather than states, letting a thousand flowers bloom, which will, at the end of the day, limit options.
Yeah, so I will share a HIPAA-related anecdote. When I go to doctor's offices and you fill out the forms, especially new doctors, you fill out the forms, and they say, check this box to confirm that you've received, the HIPAA guidance and that you understand your rights. And oftentimes they don't provide you with the actual disclosures. And as a lawyer, I won't sign it. And I'll go back to the desk and say, well, you didn't give it to me, so I won't acknowledge that I received it because you didn't give it to me. So if you want to give it to me, and then they look at me like I'm crazy, of course. Other times they give it to me, and then I'm sitting there redlining. I'm like, I'm not signing this, I'm not signing that, but I'll sign this. And I redline it, and they look at me like, I'm just like, take it or leave it. This is how it's going to work.
And normally they'll take it, I bet.
Yes, they will. They will take it. They will take it. But I say that to people, just like, don't check the box, because I've also noticed it's not always the same. The disclosures aren't always the same in every doctor's office. But at least understand what the disclosures are before just check it. Check it. We're so quick to check a box without like really realizing what we're checking and submitting to.
So, nobody reads the fine print.
That's right.
But putting that signature, as you would know well, Donna, on that dotted line doesn't obviate the need for full compliance and making sure they're doing their due diligence, the healthcare providers, in adhering to state law. But I hear you loud and clear. We move every time we update software on our phones. Who's reading that?
So I would be remiss in not bringing up, I think, some of the issues that I think are top of mind for the country, top of mind, I'm sure, for many of your members. I think first and foremost is we're in a post-Dobbs, Roe v. Wade world. How has the climate around reproductive rights has it changed? And has it led to more provisions restricting the collection of sensitive health data processing and the use of telehealth? How has it impacted telehealth, if at all?
Well, we're still assessing, I have to admit. When the decision came out overturning Roe v. Wade by the Supreme Court now, gosh, was it 2 years ago? Coming up on 2 years, at least when we first got a look at that draft leaked opinion. I must admit I was concerned because breaking down interstate barriers to care, creating consistency in compliance is, again, like I said, a huge overriding interest of the telehealth community. And it is predicated on states trusting each other, on red states and blue states understanding that. For purposes of telehealth, because of decades of precedence, you must adhere to the laws of the state in which the patient is located. And so I was very concerned personally, and our members were very concerned that this could lead down a road of a rapid disruption of what had been an emerging consensus in this post-pandemic age of increasing the number of providers that patients in your state could have. By and large, the worst scenarios have not come to pass yet. You have seen increasing examples of states trying to either indemnify their providers from any coercive action from other states, or you've seen other states try to strengthen the ability of those in law enforcement capacity to go after providers out of state that aren't complying with their state laws. And that dialogue still goes on. Every now and again, there's a major news breakdown of it. Folks that are deliberately trying to, for understandable reasons from their perspective, try to push the limit of what is and is not allowable in our federal system. However, in the ensuing 2 years, we've had a continued adoption of various licensure compacts. We've had continued ability to come up with new ways to deliver care across state lines. We must be very vigilant as a community of telehealth advocates to make sure that as these issues get settled by state governments, by the courts, by potential federal interventions, that we don't lose sight on what there is agreement on, and that we hopefully continue to build upon that agreement to, at the very least, find out ways to continue to deliver care to the most number of Americans possible and the most number of services possible.
I do want to get to AI. You mentioned it very briefly at the beginning, and I know that your organization has developed some AI principles. Has the definition of telehealth broadened? Has it changed with the adoption of new technology? And, does Chat GPT come into play and other AI models that maybe used more regularly in the healthcare community? I mean, talk to me about AI. I don't know if it's possible to have a privacy conversation these days without the letters AI. But I would love to learn more about, your AI principles and how AI is impacting telehealth.
Like the rest of the United States economy, healthcare has been greatly impacted by AI. For telehealth, that's deployed in things as simple as administrative details. How quickly can you meet with a provider? Who's the right provider for you? What's the nearest time where you could meet with that provider from a broad-based pool of providers across the country? It could be a follow-up email or note to you from your provider that not only includes your lab tests, as it would have been the case in years past, but also gives, based on other information that they have, based on your health data, a really bespoke email describing what the ramifications are, what the recommendations are now that we have this information of your latest lab test results. That type of thing that is hardly scary and shouldn't raise really broad concerns. Our principles are making sure that there's accountability in place, making sure that AI is a tool like any other that has got human oversight, and that AI is not a licensed medical professional. What we're really worried about, as I mentioned earlier, one of our core policy principles at its foundation is leaving no American behind. Is of making sure that we're having appropriate levels of access to care for underserved Americans, folks that haven't been served well by our healthcare system. That means as we deploy AI, we must have guardrails in place to mitigate and prevent against bias. Just like on the data privacy, clear regulatory guardrails. We want to know what are the guidelines, what are the guardrails, how can we comply? And we want to know that on the front end before any type of adjudicative action is taken on our members on the back end. We shouldn't have any ex post facto enforcement of laws that have been created whole cloth, new guardrails that have been created whole cloth without knowing as we go into it what those are.
Would you argue that the existing laws that we have address the use of AI, right? I mean, do we need a law that's specific to AI? Or do we already have laws that are fairly agnostic to technology and would apply to AI? And along with organizations like yours providing principles, right, with regards to best practices in use. But do we need, like, the EU has released their AI Act. Does the United States need an AI Act?
Right, and I know Brazil, for instance, we just the ATA just convened a dialogue with a Brazilian parliamentary mission on this topic as well, because they're considering a new framework there in Brazil. I'm not sure how, we certainly shouldn't rush into it. And actually, I give great credit to both Republicans and Democrats, certainly to include and being led by the Biden administration, and how thoughtfully they're proceeding here. Very rarely any longer in this very polarized age do you see committee hearings where members of Congress, representative senators come with legitimate questions to which they do not know the answer. And, now there is no partisan real grandstanding being done on this topic. Instead, it's being a very thoughtful, considered approach. To answer your question, Donna, I mean, do we have enough rules and laws in place that would prevent the need for new legislation? I think it's an open question. One thing, of course, we would greatly prefer, like on privacy, it would be ideal if we could have a federal framework, again, like a HIPAA in place that would prevent states zigging and zagging and creating a hodgepodge of laws that are very difficult to comply with across the country. But one thing I would say, Donna, is that for understandable reasons, there is a lot of concern that smart folks have that have thought about this very deeply about the implications of AI in the U.S., broadly speaking, broader than just healthcare. We do not take in any way a pessimistic approach to AI. We're very optimistic. Yes, there are considerations we have to take on board. Yes, we have to make sure our workforce is being trained to deploy this tool. Yes, we have to make sure there's accountability for this tool. Again, that goes back to that human being that's providing oversight and ensuring the standard of care is met. But in terms of meeting our healthcare challenges, creating bespoke healthcare strategies to make people live longer and happier and healthier lives, to mitigate the workforce shortage issues that we have, an aging population combined with an aging healthcare workforce, we're extremely optimistic about what AI can do in bettering the U.S. healthcare system. And we see so much to be optimistic about, and we are not in any way frightened of the future of AI getting more involved in healthcare.
Mm-hmm. Are your AI principles available to the public, or is it just for the members?
And they're absolutely available for the public at americantelemed.org. And that's where you can find all kinds of letters and statements and principles that we put out. And it's also where, for instance, your listeners and viewers could go to find out more information about our upcoming conference in Phoenix, May 5 through 7th, our Nexus conference. It's our annual conference where a couple of thousand folks that are the brightest minds come together to harness their collective intelligence to talk about telehealth broadly, and obviously to talk about health data privacy and also how AI is being deployed in virtual care.
Great. So we will provide links to all of that in our resources for all of our listeners for sure. So, Kyle, I want to wrap up and ask you to look into your crystal ball and tell me what trends or expectations you have for consumer health, data privacy in the year ahead, and what are you most excited about, or what's keeping your hair on fire?
Well, we are going to be eagerly paying attention to those federal conversations that I mentioned. The Biden administration has pulled together its own work group to think through these issues. Congress continues to hold hearings. And like I had mentioned, I think these are the public hearings and the workforce plans in place that are thoughtful, that aren't rushing into what comes next. At the state level, we're continuing to be mindful of state legislatures that might grapple with these issues and making sure that they know the perspective of our broad-based membership and hopefully getting these policies fine-tuned. And then most importantly, I would say writ large for the telehealth community is what we're calling the telehealth Super Bowl at the federal level. For one reason or another, for either legislative or regulatory purposes, all of the favorable flexibilities that came about during the pandemic essentially are set to expire on December 31st of this year, unless Congress or regulators take an appropriate course of action. So we're on the field trying to make sure that we win this telehealth Super Bowl, and we'll know whether or not we have or not by the end of the year.
Great, fantastic. So as someone who uses telehealth, I thank you personally for your work and your organization's work. This was a really interesting conversation for me personally. I hope that our listeners find it as formative as well. Kyle Zebley, thank you so much for joining us today. This was a very informative and interesting conversation. I want to thank everyone for listening to us today. As always, if you missed any of our previous episodes, please check them out at accountabilitystudios.org, Apple Podcasts, Spotify, or wherever you find your podcasts. Please be sure to leave us a review and let us know what you'd like to hear next on Privacy Alleviated. Thank you so much. Thanks for listening to us today. As always, if you missed any of our previous episodes, you can check them out at accountabilitystudios.org, Apple Podcasts, Spotify, or wherever else you find your podcasts. Please be sure to leave us a review. Let us know what you'd like to hear on our next Privacy Abbreviated podcast. And please check out our resources related to today's episode. And thanks again for listening.